Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Well, we've been told repeatedly that people in hotspots will be prioritized to get vaccinated. We've been told to register, to follow the guidelines for registration and booking. And what do we see? Surprise pop-up clinics that in no way guarantee the people who need it are actually the ones getting vaccinated. It is total chaos. There are hours-long lineups. People waited in line 4, 5, 6 hours. And people camping out overnight because they heard rumors about unconfirmed clinics on social media. We are told that people are even driving in from other areas to these clinics while frontline workers can't get vaccinated because they're busy at work, and local residents get left out. So will the Premier get up today and admit that surprise pop-up clinics have caused added concern and anxiety, and that he will ensure that those who live in hotspots and those frontline workers receive the vaccination that they've been promised?
Minister of Health.
Thank you, and thank you to the member for her question. The member will know that our primary COVID-19 immunization campaign is age-based, focused on clinically vulnerable people as well, and focused on Indigenous people 18 and above. This evening, people 58 and above, born in 1963 and before, will be eligible to book their appointments. And as we get more vaccine in the next week, that number will increase. So I encourage everybody to register. To address hotspots, particularly in the Fraser Health Authority, the Fraser Health Authority has forwarded a number of pop-up clinics. And I'm happy to inform the member that yesterday, the 4 that were added yesterday immunized 4,100 people, and that overall in Fraser Health, almost half of the immunizations yesterday took place in the 10 community health areas. There are more than 40 in Fraser Health that are currently assessed as hotspots. This is one other measure to deal with transmission, just as the immunizations of many school staff, of many frontline workers that are taking place, and others have done so now and in the past few months. I think that our vaccination effort has been overall extremely successful. And yesterday we were able to reach hotspot areas, which we hope will help serve to reduce transmission in this COVID-19 pandemic.
Leader of the Official Opposition on supplemental.
Well, thank you very much. And while I appreciate the minister's answer, and I do have a great deal of respect for the fact that he knows and manages his file well, and let me make it perfectly clear to apparently some member who thinks that this isn't the case. We want to make sure that British Columbians have the opportunity to be vaccinated when they are promised.
Through the chair, member. Through the chair.
We also want to ensure that, and we're very glad that people are actually eager to get their vaccinations. That actually matters to us on this side of the House. So we're very happy about that. What we're not happy about is that the Premier doesn't take the opportunity to get up and stand up and tell British Columbians why, yet again, there is another mess. We started with pharmacists who didn't know they were on the list to give out vaccinations. We moved to travel restrictions, which people still don't know exactly how those work. And now we have pop-up clinics. Again, we care that people get vaccinated, but I'm sure the members opposite don't believe that you should be sleeping overnight in a tent to wait for the vaccination that you have been promised. One person who needs to be able to stand up and tell British Columbians how he is going to clear up the confusion and anxiety that's been caused in British Columbia. I'm sure that even the Premier would agree that rumors on social media are not a valid vaccination plan. And in fact, it is hurting and hindering workers and people who have language barriers. Members might want to dismiss my comments, but how about the comments of a physician from Burnaby? And here's what he had to say. Dr. Narang, a family doctor from Burnaby, says, and I quote, "These are the same people that aren't going to be able to get to a pop-up clinic. It's going to be the people who are sitting on Twitter or who do not have the language skills to interpret it and accessibility to a car to get to these appointments," end quote. So will the Premier commit today to ensuring that those British Columbians who need the vaccination. We agree with that. They need it now in order to continue to bend the curve in the third wave. They were promised by this government that those who were prioritized, including frontline workers and hotspots, would get their vaccination. Would the Premier ensure today that they indeed get them?
Premier.
Thank you, Honourable Speaker, and I thank the Leader of the Opposition for her questions. She will know that as of today, 1.7 million British Columbians have received their first dose. She will know that just shy of 40%, 39.66% of the eligible people for vaccinations have taken their first dose. This is positive news, Honourable Speaker. The member referred to the possibility of vaccine hesitancy. It clearly is not the case here in British Columbia. Again, all good news for all of us. But it's my job and my role as the head of the Cabinet and the head of the Executive Council to make sure that all of the people that have been given tasks have the space and latitude to take on those tasks. Never more important, in my opinion, Honourable Speaker, than during a global pandemic. I want to endorse the position of the Leader of the Opposition in affirming the extraordinary work done by the Minister of Health over the past 14 months. He, alongside public health officials and with the support most days of every member of this legislature, and I say that quite sincerely, Honourable Speaker, virtually 99% of the time, for those watching at home, all of us in this place agree on the fundamental principles that are before us today. But I cannot, in good conscience, interfere in the processes that health officials are putting in place to make sure we address those hot spots. I'll leave it to them to decide what the best method is to deliver a scarce resource to a demanding population. I believe that we have a good track record to this point in time, and we're going to continue to work to make sure that those vulnerable populations, those that have pre-existing health conditions who are being prioritized, those frontline workers that desperately need to have those vaccinations are getting those vaccinations, but we have a shortage of supply and a narrow window to get that into the arms of British Columbians, and I'll leave it to public health officials to make those important decisions.
Member for Kelowna Mission.
Thank you, Honourable Speaker. Well, unfortunately, it's not just the Premier's surprise pop-up clinics causing confusion and chaos. People who got vaccinated at their local pharmacy are now being told after the fact that they also need to register on the government website. But the pharmacies and their clients were not informed at the time. While many are still struggling to get their first dose, we can't have any confusion on the second. Can the Premier please clarify, if you have an existing second dose appointment booked with a pharmacy, is it still valid?
Minister of Health.
Thank you, Honourable Speaker. I'm encouraging everyone in BC to register for a COVID-19 vaccination on our Get Vaccinated website. This is an important principle that will assist them throughout the vaccination process, as the member suggests, involves 2 doses. With respect to people who've received AstraZeneca at pharmacies, that would have happened at some time in the next 4 weeks, and there is some time before their second appointment will have to be booked. And in that time, people will get lots of information and lots of advance notice. It is useful for everybody to register. It takes 2 minutes, and almost 2 million British Columbians have registered. The system has been extremely successful in particular at targeting those clinically vulnerable, 180,000 of whom have been vaccinated. Our pharmacy campaign so far, I know it was characterized otherwise just a few minutes ago, 185,000 doses sent to pharmacies, 163,000 vaccines delivered, with more appointments booked and the rest to be used up in the coming days. All of those individuals will be eligible for second doses, and I encourage everybody in the coming days to register. Yes, some will have booked their own appointments with London Drugs or whoever it is that's booking appointments, but it's important and valuable to register. And Honourable Speaker, I can say that well in advance of needing a second dose, which for people who are vaccinated in April will be August, people will have all the information they need to proceed.
Member for Kelowna Mission on supplemental.
Thank you, Mr. Speaker. Honestly, I listened to that response from the Minister and I'm still confused. People don't know if it's the government that's making appointments or if it's the pharmacy that's making the appointments. The BC Pharmacists Association is saying something completely different than what we just heard. And I quote, "Those who have received their first doses at a pharmacy will be contacted by their pharmacist for a second dose." End quote. These are basic questions that shouldn't even have to be asked. Will the Premier please provide some basic clarity about re-registering for vaccine appointments so people can be certain that they get their second doses on time?
Minister of Health.
Honorable Speaker, I encourage everyone to register with our Get Vaccinated website, Vaccinated website. It's a valuable thing to do. It's easy to do. Almost 2 million people have done it. It takes approximately 2 minutes. And I think it's worthwhile for everyone because it will also provide, as we go forward in the future, access to your vaccination information. So that's something that's useful to do regardless of when you got your vaccine. There are many people, as the member will know, who receive their immunizations, lots of those in long-term care and assisted living, but in other places, especially healthcare workers, who are vaccinated in advance of the website coming into being. And so we are continuing to encourage people to get registered. It's pretty straightforward. The people who are immunized in the pharmacy campaign will get their second dose in August or in September, and there'll be lots of information provided to do that. So, Honourable Speaker, I appreciate that the Honourable Member expresses the view that she's confused, but I don't think there's any reason to add to that confusion. It's pretty straightforward. Everyone get registered and let's go.
Leader of Third Party.
Thank you, Honourable Speaker. Yesterday, the Premier finally announced an intention to fix the gaps in the federal sick pay program that leaves people forced to choose between staying home when they feel unwell or providing for their families, and leaves all workers much more vulnerable to COVID. In the midst of this third wave, fixing the gaps in the federal paid sick leave program is long overdue. I'm happy to hear of this intention, but I'm concerned about the timeline and the fact that there are still no details on an immediate program. Like many of the big issues facing British Columbia, this government seems to be waiting on federal leadership instead of being proactive. Creating a program to fix the gaps on paid sick leave should never have been put on the shelf, hoping that another level of government would take the lead. My question through you, Honourable Speaker, is to the Premier. Why did his government wait until after the federal budget, leaving us so far into this pandemic and into this third wave before deciding to act on sick pay?
Premier.
Thank you, Honourable Speaker, and I thank the Leader of the Third Party for her question. She will know that this government has been leading the discussion across the country with respect to paid sick leave. For over a year now, Honourable Speaker, I've been raising this issue at national tables that I have the privilege of sitting at, representing all of us, and bringing these issues forward. I was given a commitment, although I have to confess it was lonely at that time. I don't recall ever hearing from the official opposition a word about paid sick leave until yesterday. But I will say I want to commend the member for Shuswap for acknowledging today, on this most important of days, that we have all come to a new realization and understanding of the importance of these issues because of the challenges that we've all faced. So I lift my hands to the member for Shuswap for acknowledging that today. But with respect to the federal government, we had commitments from the Minister of Finance and the Prime Minister that there would be an effective national program. When they launched their program and it became abundantly clear that there were gaps and deficiencies in the program, we continued to lobby and advocate, and were given assurances that there would be a fix. We waited till the federal budget was presented and found that there was no fix available. We are now 7 business days since that time.
Members.
And I'll remind again the members from the official opposition, we wanted to bring in 3 hours of paid time to get a vaccination, and they spent 4 days debating it. 4 days to give people 3 hours off to get a vaccination. So I'm encouraged that when we bring legislation in this time, it will pass in 1 day.
Leader of Third Party on supplemental.
Thank you, Honourable Speaker, and thank you to the Premier for his response. I think that right now, in this third wave, that what workers are concerned more with is not who's leading the discussion, but who's leading the implementation of a policy that will ensure that they can stay home, when they are sick without risking being able to not pay rent or buy groceries. The Premier said about designing a sick pay program that, quote, "It's not about speed, it's about making sure we get it right." I respectfully disagree. Right now, time is of the essence. Workers should not have to choose between staying home when sick or providing for their families. And on this day of mourning for workers who have been killed, injured, or exposed to illness at work, we need to know that this government will work to protect workers right now. We need an immediate emergency program, or we are missing the most critical period of time during this pandemic when people urgently need the supports in place so they do not go to work when they feel unwell. My question again through you, Honourable Speaker, is to the Premier. Can we get clarity on exactly what the government is working on and when exactly this program will be rolled out to support workers?
Premier.
Thank you, Honourable Speaker. And again, I appreciate the question from the Leader of the Third Party. And as of 2 o'clock today, we have, I think, unanimous consent in this place to bring forward a paid sick leave program, and that will be happening in the days ahead. I look forward to the very brief debate and the implementation of a program that will protect workers.
Member for Shuswap. All right, members. Member for Shuswap has the floor. Proceed.
Well, thank you, Mr. Speaker. Workers deserve to be safe and protected, especially during a pandemic. Last year, the Premier was adamant that he was ready to implement a provincially funded sick pay program. Last May, he said, and I quote, "We're prepared to go it alone. We do have alternative plans in place," end quote. But he hasn't done it. So once again, we have a Premier who shows up, makes big promises, messes up, and fails to deliver. Through you, Mr. Speaker, to the Premier, what is the Premier's plan for a provincially funded sick pay program that he claimed to have ready to go a year ago?
Premier.
Thank you, Honourable Speaker. And again, 2 consecutive days of interest in workers from the official opposition is a day to celebrate. And I'll remind the member who was just on his feet that he spent 4 days in this House, 6.5 hours, debating the merits of 3 hours off to get a vaccination. So I'm heartened, Honourable Speaker, by the volume coming from the other side that their newfound enthusiasm for workers isn't just confined to ripping up their contracts, but instead they want to help them. Thank you, member, for your support.
Member for Shuswap on supplemental.
Well, Mr. Speaker, I was just trying to do our part. The only bill that was actually on the floor for debate in this legislature was Bill 3. Now, Mr. Speaker, yesterday the Premier claimed, and I quote, "It's not a simple process. There is no structure in place," end quote. But a year ago, he said he had a plan that was ready to go. So if there's still no structure, it's because he's botched it. Hard-working men and women took the Premier at his word when he said that he had a plan in place a year ago. They don't want excuses now. Mr. Speaker, I can think of one group who are really counting on the Premier not to blow it: the 20 to 39-year-olds who don't want to have to choose between paying their rent or getting people sick. Through you, Mr. Speaker, to the Premier, will the Premier tell us why he told everyone that he had his own provincially funded plan when it is now apparent nothing could be further from the truth?
Premier.
Thank you, Honourable Speaker. And again, I thank the member for his newfound enthusiasm in this area. He may well remember that last spring, when we were advocating on behalf of British Columbians to the federal government for a national sick pay program, we weren't joined by the BC Liberals at that time, but we were joined by the BC Chamber of Commerce. We were joined by the Boards of Trade from Vancouver and from Surrey, as well as the BC Business Council, as well as the BC Federation of Labour. And
Members
even
will
the
listen to the
independent
answer.
contractors had to suck it up and support the government. Imagine that. But despite that, the farm team for that organization couldn't find the temerity to stand up and support this initiative. I'm grateful they're doing it today. I look forward to unanimous consent at the appropriate time in the days ahead.
Member for Kamloops South Thompson.
Thank you very much, Mr. Speaker. Well, what we're talking about here today are thousands of hardworking British Columbians, frontline workers, essential workers in many cases, young workers, people of color, lots of women that have been bearing their more than their fair share of this pandemic, who were promised by this Premier 1 year ago that a sick pay program would be put in place, and the Premier didn't do it. Mr. Speaker, we, the official opposition, actually wrote to the Premier in May of 2020, encouraging and urging the government to get on with a sick pay program. Perhaps he needs to be better briefed. The Premier is blowing it. He's blowing it for 20 to 39-year-olds. He knows that's the case. Yesterday, the Premier said, and I quote, "Paid sick leave is critical to get through the pandemic," end quote. But, Mr. Speaker, Laird Cronk and the BC Federation of Labour says the Premier is failing. And he's had this to say, and I quote, "The budget fails to ensure paid sick days and to remove the untenable decision for workers between staying home sick and paying the bills during a pandemic," end quote. The Premier said he had a plan ready to implement a year ago. What is the Premier's plan for a provincially funded sick pay program?
Minister of Labour.
Thank you, Honourable Speaker. I'm really happy to answer this question, and then thank you the opposition for this question. Mr. Speaker, I know that the BC Liberals are waking up to today to this new issue. I'm surprised actually that they have taken an interest in the workers' rights now. I don't need to remind this member, Mr. Speaker, he was part of a government who for too long, for 16 years, disrespected the workers and showed nothing but Mr. Speaker, nothing but contempt towards the working people. This was the government, Mr. Speaker, that cut benefits to the injured workers. This was the government that shut down half the employment standard offices and fired half of those workers, Mr. Speaker. If that wasn't enough roadblocks to justice for those most vulnerable workers in the BC, they threw in a self-help kit, Mr. Speaker. They were told if the workers felt that their rights were violated, they were told, fill up these papers, go talk to your own employer, you're on your own, Mr. Speaker. And I'm not even talking about how they ripped up the collective agreement that were legally negotiated. Only the Supreme Court of Canada tell them their actions were legal, Mr.
Thank you.
Speaker. When they're waking up, Mr. Speaker, we've been working for the last year to provide support for the workers, making sure that the workers don't lose their job when they're sick with the COVID sickness, Mr. Speaker. We will continue to work. We will have a plan in place, Mr. Speaker.
Thank you, Minister. Thank you. Member for Kamloops South Thompson on supplemental.
Well, what a pathetic, nonsensical answer that was, Mr. Speaker. This is the same Labour minister who just the other day said, and I quote, "As the Premier has said, if the feds fail to work with us, I think we as British Columbia will find our own ways." The Premier made it very clear. Mr. Speaker, the Labour minister has said that they would put a program in place. More importantly, the Premier, the head of the Executive Council, has said that he had a plan ready to go 1 year ago, and we're still waiting. And so are the thousands of British Columbians whose health is at risk. They're still waiting, Mr. Speaker. People took the Premier at his word when he said he had a plan a year ago, and they certainly don't want his excuses today. But this is the whining that we heard from the Premier yesterday, and I quote, "It's sad, I think, sad to say at month 14 that we haven't resolved this issue. It was a critical issue 12 months ago, and we're still talking about it. That disappoints me," end quote. Do you know what's sad and disappointing, Mr. Speaker? It's a Premier who broke his promise on sick pay and can't deliver. Now, the question is this. The Premier is sitting on $3.1 billion of contingencies in the budget. $3.1 billion. Where is his plan for provincially funded sick pay programs, a program that he claims to have ready to implement that workers across this province desperately need today?
Premier.
Thank you, Honourable Speaker. And if only the official opposition had a modicum of credibility when it came to standing up for working people. If only that was the case. I mentioned, Honourable Speaker, the organizations that have traditionally been supportive of the BC Liberals, the BC Business Council, the Boards of Trade, the Chambers of Commerce. To a person, they stood together with us and said, we need a national plan in Canada. We need a national plan in Canada. And today,
wait a
Honourable
minute,
Speaker,
Premier. Members, you asked the question. Now let's listen to the answer, please.
Thank you, Honourable Speaker. Thank you. And again, I'm grateful that I've heard today from at least one member of the official opposition, the member for Shuswap, that he recognizes and acknowledges the importance of moving expeditiously on this. So when we bring it to the legislature, when we return from the constituency week, I'm grateful that he will second the motion, and all of the members on that side will vote up unanimously to support paid sick leave for British Columbia.
Member for Skeena.
Thank you, Mr. Speaker. And we are a third of the way through the Premier's travel restrictions, and we still don't have answers on how it will be enforced. These include basic answers about what happens at the actual police checkpoints. People want to know if a police officer enforcing a checkpoint will turn someone around, or if they'll just give them a fine and let them continue. Which is it? Will the Premier tell us if police can detain and turn people around at checkpoints or not?
Government House Leader.
Thank you, Honourable Speaker. As I indicated last Friday, that later this week the enforcement provisions will be made public in terms of the details of how the COVID checks will take place when they're implemented by the police in the province of British Columbia. I can tell you that we've been engaged with discussions with police in terms of how things will work, in terms of legal services branch, in terms of how the order will be constructed under the Emergency Program Act. I can tell you we've had discussions not only with members of the BIPOC community, but with local government. I can tell you that the opposition is going to be briefed tomorrow. And what I can tell you this, Honourable Speaker, is that most British Columbians understand what's in place, which is stay local, stay within your health authority, and that's what they're already doing.
Member for Skeena on supplemental.
Thank you, Mr. Speaker. And to be honest, that doesn't answer the question. People need to know right now what the police powers are at the checkpoints, and they should have known the day that the Premier made this announcement about checkpoints in the first place. Police and the citizens of BC need an answer. They deserve an answer, with all the confusion adding to the stress and anxiety of this COVID crisis. We don't know if the police will be detaining drivers or not, and whether or not they can force drivers to turn around. Will the Premier be turning around drivers at the checkpoints? Yes or no?
Minister of Public Safety.
Thank you, Honourable Speaker. I can tell the Honourable Member that the Premier most definitely will not be turning around people at checkpoints. But what I can also tell the Honourable Member, that the police who are working or will be working at the checkpoint or checkpoints are professionals who are well trained and know their job and know how to treat people respectfully and courteously. And so it's not a question, and they've been doing it for a very long time. And what we have been working with is the police in terms of the order as it will be in place, how it will be implemented, and where it will be implemented. And we've also made it clear over the last week that, for example, it is not going to be random around health authorities, but will be at the borders between those health authorities, in particular the one between the Lower Mainland and the interior. That's because that's where the issue of stopping the spread of the virus is most effective. We are already seeing that the restrictions that have been put in place at, when it comes to ferries, for example, are working extremely well. I can tell the member, for example, that already on this past weekend, the Tsawwassen-Schwartz Bay route, vehicle traffic down 24%, passenger traffic down 34%. I can tell you that in terms of Horseshoe Bay departure route, vehicle traffic down by 37%, passenger traffic down by 42%. That's already on reduced capacity, Honourable Speaker, because you know what? The public understands the restrictions. The public understands the need to stay local. It's a shame they don't.
The bell ends the question period.